Welcome, everyone. We're excited to welcome you to a digital collaborative venture of an Ignatian conversation where we're reaching out to the whole global perspective. As we know, the Jesuits and Ignatian ministries span the globe, and especially in this day and time, it's a value to reach beyond our normal areas, our normal borders, and learn from others. And so we're very excited to have with us one of the Jesuits from Chile to share on some of the great work that they're doing there in terms of opening their doors and making their space available to those in need. This is very much in line with the normal Jesuit mission of all our institutions, of all of our partners. It's also very much in line with the generals and the society's recent apostolic preferences, which invite us to walk with the poor, to be in a general spirit with all those that are marginalized. And a number of you might have seen recently the Father General's address on how at this time we're even more encouraged to look at the ways in our area that we can help those in need. And we know, especially in our Los Angeles area, how many are in need, in dire need, in normal circumstances, and especially even more so in this time. So we are excited to have the opportunity to reflect for ourselves and to learn from others about what is happening. And I'm going to turn it over now to Federico, a Jesuit at Verbum Dei, who brought and kind of bridged these worlds, brought this connection together. So Federico, would you mind saying a little bit about that?
Yeah, well, a few days ago, looking the almighty media, through Facebook, I saw this posting about the Jesuits in Chile opening their retreat house for those who are sick or will be sick from the coronavirus. And I posted, for me, is a moment also, listen the Father General, listen the Father Provincial, listen, this searching for new ways of ministry, for me was a big green light, coming on, the light turned it on as I saw the article and read the article, and I posted, and Frank Buckley also saw, and from there we start to talk, and it has been a pleasure and an honor to reach the Chileans Jesuits and Father Agustin Moreira there, and others, to listen from them, from firsthand. It has to be a process before this happened. It had to something, conversations, thinking, reflection, discernment, and I think that could be key for us. Maybe not to do the same thing, but to search for new ways to do in this context of LA, Southern California, US, and I feel honored, and I'm very blessed, Padre Agustin, for listen from you and having you enjoying us and all the openings to engage with us this morning. Thank you.
So Father Agustin, thank you very much for being with us. Would you just share a little bit about who you are and what your involvement is with this current project?
Well, as you said, my name is Augustin, and I work as treasurer of the Chilean Jesuit province and also as chaplain in a couple of high schools. But my main work is related to the as treasurer of our province here in Chile. And I would like to say also that we are also learning on what other people and what you are doing also, because as we are in the Southern Hemisphere, the coronavirus has struck us heavy, but a little bit later than you. So we've managed to learn a lot from what's happening in Europe and also in the US.
So as I understand it, we'll just say a little bit about what the what you've undertaken, and then maybe I'll ask about how it came about. But as I understand it, you've taken one of your retreat houses and you've made it available to the elderly who've been infected with coronavirus. Is that a good description? Could you say more about what the project is?
Well, as the pandemic has been increasing, we're still with low numbers yet, but that doesn't mean it won't grow and it won't get harder and more difficult. We have 6,000 infected, and we've had 50 people that have died. And this scenario will get worse within time. So we realized we had to prepare ourselves for a worse scenario. And also we realized that our retreat houses were empty because people had canceled all the retreats. So we realized this was not my idea, but it came out, well, what can we do with our retreat houses in this scenario in which a lot of people will need a space where they can be treated and they can be isolated. So we realized that we had this opportunity, and we took contact with the health authorities in Chile and offered our retreat houses in the different cities we have, with the possibility to be a space where infected people could get there, especially elder people and poor people, so that they can receive treatment and they can also, if possible, overcome the disease. So through that contact with the health authorities, they went to visit our retreat houses, and they realized, well, this is, you have the facilities we can use, so we can come to an agreement in which we can both win through this agreement. And we made a very simple agreement contract with our lawyer, in which we would handle our houses for their administration, and they would cover most of the costs. And we told them, we're not going to profit from this. All we want is to help, and everybody needs to help in a scenario that it demands the best of all of us. We all have to contribute. So this wants to be our contribution. We don't want to make money from this. We don't want to profit, but we have these retreat houses. We offer them to you so that you can administrate them in the best way you can to help people that are sick and in need of help.
It's a wonderful example of generosity, and I think the spirit of what we're called to, of reaching out. And I'm impressed by your efforts. I think it's a great example to us. In some ways, it's very natural, right, to take these rooms that we are empty and know that there's people in need and offer them. At the same time, it's a big step. It's not necessarily an easy thing to open up a place or an institution to a completely different purpose. Could you say a little bit about the process that you went through? Meaning, you or the Jesuits that you were involved with, what were some of the considerations? Was it an easy flow? Were there questions that came up? Just anything about the process of making that decision that you could speak to.
Well, I would say the process was quite simple because the Provincial was agreed to this idea. He said, well, we have to do something, we have to contribute, and this is a way in which we can do it. And so let's see that we can do this in a simple way. So the health authorities, they gave us the name of a person whom we made contact, and that person visited our houses. We showed them all we had. In one of the houses, which is Loyola House, it's a house that has 280 beds. And a Jesuit community was living, a Jesuit community of 8 people were living there. And they asked us if the Jesuit community would be able to leave the house so that they wouldn't get infected, and so they would have more better facilities, and we agreed to that. And the superior of the Jesuit community, he also was very open-minded and very keen to contribute and collaborate. So we had no problem with him. And the Jesuits went to another community, and the parish of that place of where the retreat house is, he was received in a house, in a neighbor's house. They offered him to stay there so he can keep the masses, etc., and the pastoral work. But it's been a quite easy process. All we ask is that we can't go into many high costs, but the government has told us, and the authorities, they have told us that they can keep up with all the costs related to this program, and they had also they were concerned about when this process finishes, they will give us back the house in the conditions we gave them and sanitized, so that we won't get more infections. So it's a house that's in very good conditions. It's been offered to the health authorities so that they can handle in a better way this pandemic that's increasing here in Chile. And what I told you before, we've learned from other countries what's happened in the US, and mainly in Spain, in Italy, France, etc. And we realized we all have to contribute. We all have to contribute because otherwise all the health system won't be able to cope with the high demand of sick people. So if we avoid the collapsing of the health system, we will be in a better shape to overcome this pandemic.
Well, it's, yeah, again, a great example of your willingness to adapt, and to that Jesuit community and the people there who were willing to move from their homes in order to make this happen. Again, as you say, it's something that we hear about. We know we need to all contribute and take steps, and yet when it comes down to the difficult personal decisions about moving locations or being displaced, that's still a serious step to undertake. So I think it's very admirable, both for the Provincial and for all those Jesuits who are willing to make those change. We know we believe, certainly in as part of these ministries, that we act in this way of generosity, believing that it will serve the good of others and the good for all of us. Is there been anything you could speak to about what some of I know it's early, but if there's any graces or anything that you felt has been good that's come out of this process already?
Well, this came out in the media, and it has been very well received by Chileans. They felt that that's what the church has to do. So that's been a very I'd say it's very glad for us that people are feeling that, well, we can contribute, we're doing something, we're helping, and this invites other people to have different attitudes and different gestures in which they can contribute. And I think this creates a positive way of handling this pandemic.
No, it's so true. I think we can be encouraged by the examples we see from others, and sometimes even think of new possibilities because of what's been modeled for us. How wonderful that it's been received that way by the public and others. It's the kind of thing that we hope our institutions will stand for. Of course, these things also involve their challenges. Is there any specific challenges you can speak to? Obviously, it was difficult to go through some of the conversations to move people around, but what would you say have been some of the just kind of challenges you might have faced so far?
Well, I would like to say that in difficult times, you will usually see the most generosity of people, and sometimes the worst. You will see the best and the worst. But I think this is an example in which we've had, I can honestly say we've had no real problems to do this. The generosity of the community was surprising. How they, in 2 days, they had to leave their home with their belongings and adapt to a different community, and they were willing to do it. They had to work hard because they had to pack their things and get out of leave their home. But they they had a great generosity, which I'm very grateful for that. And there's another thing that I suppose most Jesuit communities have done, but we worked with the Provincial, an invitation in which every community had to go through their annual budget and see what were the things they were not going to use and what were the items in which they could reduce, so that they could make available an amount of money they could handle for the poor. And all the communities have done this exercise, and they've realized that there's an amount of money that they are willing to handle over for the poor. And we're opening, through our social work, we're opening many, in many of the places where we're working, we're opening places where we're cooking for the people that have lost their jobs and are hungry. And we're preparing ourselves when that amount of people will increase, because nowadays we have around 8% unemployment, but that will probably go up to 20 or more. And there's going to be families that are going to be hungry. They won't have anything to eat. So we're trying to prepare ourselves to handle the money and the means so that we can organize I would say, public cooking, where we cook for people that don't have what to eat.
It's another great concrete action that you're taking. I appreciate that what you're mentioning there, especially because, of course, those are situations that we're all looking at, and particularly here in terms of the unemployment rates and the access to basic essentials of food and water. I know particularly for us here among those who are suffering from homelessness or just right on the margins economically. So it's another great reminder of a group in need. Is there anything that you might just say to us from your own experiences, as we here in California in the United States are trying to think about what can we do? Any kind of thoughts, particularly perhaps to Jesuit institutions, to Jesuit communities?
Well, I think also that the experiences we've had in our community, I live at Belarmino community, in which we have been able to celebrate the Mass and make that Mass go by streaming or Zoom or other platforms to the people we know, and the people, well, that has been very well received. Yesterday I celebrated the Mass for the Thursday, the Eucharistic, the institution of the Eucharistic, and I was impressed by how grateful the people were and how hungry they are of a spiritual word that would encourage them to live this this situation and feel we're all in communion. Even though we can't touch ourselves, through the media, we are in communion through in a spiritual way, and also through the love we feel towards one another, towards each other. So our spiritual experience shared with others has been a great grace.
Absolutely. I think that that's such an important part of our both our challenge and our opportunity at this time is how can we stay connected? How can we create that sense of the real sacramental reality at a time when we have to be so physically distant? I'll just mention that I think this opportunity right now to be in communion with you, in communication with you, is for me a great blessing on this Holy Thursday when we are in so many ways separated from our normal routines and rituals. The opportunity to now feel in connection with people in Chile, with an example of living out the washing of the feet in a different way, I would say, and to be gathered around a different type of table, but one that's very real nonetheless. Mm-hmm. Is there any other thoughts or things that you'd like to add at this time?
Well, our provincial has received demands from public hospitals in which people are willing to have some type of relation, either through the cell phone or through one of these platforms, or physical, and they are putting us in contact with them. So I have volunteered to a public hospital in which I will visit people that are dying and help them in the process of dying, and also bring them the sacraments. But also through the telephone and through the media, we are in contact. Many of us are in contact with people that are in need of help, of spiritual advice or company. Mm-hmm.
It's another good reminder that there's so many individuals at this time that are suffering and can be isolated. And although we can't visit them in the traditional ways, we still can reach out to them, you know. So just, I think, to highlight some of the things I think you were sharing with us, both those the pastoral types of connections we can have with people now, finding new means or media to do that, the concrete ways of giving people food and the sustenance they need, and then the ways that institutions can radically reorient themselves to address the needs of so many people in this time, right? That we are able to use our resources. I'll just thank you for what you're doing and your willingness to share all this with us. Mm-hmm. I'll turn it now to see if there's any questions from that we have now that people might like to ask. Is there anyone like
yes. Well, Father Agustin, let me start by saying best Holy Thursday ever. I really appreciate you speaking to us. I heard the webinar by Father General where he said during this coronavirus to really look at positivity of being one humanity. And I'll put my psychologist cap on for a minute is what I think we need to really flourish and move forward with this are exemplars. And Ignatius talked a lot about imagination. And I know I speak for all of us. You've really opened our imagination to what is possible during really difficult times. And I think what caught my heart the most was when Father General in the webinar challenged us to really make a commitment to the poor, but at the same time, it can feel like our wings are clipped. And just the way you've been able to the Chilean Jesuits reimagine this has been, really remarkable to me. And I think the big sign as a psychologist, I always say, of mental health is flexibility. And it's easy to say no, but to really be flexible and to say yes is difficult. But I do think when we're able to have exemplars like see what you've done in Chile has been really helpful for me today. And I know for our listeners, I do a little meditation group on Facebook in the morning. And for Holy Thursday, this idea of Jesus washing the feet. And there's a ex-Jesuit who died a few years ago, Bill Spohn, wrote a book called Go and Do Likewise, and how we engage the analogical imagination to see what you've done in Chile, and then kind of in our little part of the world to imagine how we could move in a similar direction. So I just wanted to really thank you from the bottom of my heart. It was very helpful.
Thank you. Mm-hmm.
Any other questions that people might have?
Thank you. Well, first of all, congratulations, Augustine, and to the Chilean Jesuits. This is so admirable that it's very much in line with, of course, as you've heard iterated, the Father General's universal apostolic preferences, especially in walking with the excluded. and also very much in line with our own Jesuits West Provincial and fostering collaboration, recognizing that your government relationships probably are unique in Chile versus here in the United States. It sounds that you were able to stimulate their collaboration with your generosity and initiating space. Did I hear you say, though, that that the government is also managing the operations and the funding so that the Jesuits are protected from the virus?
Well, we, the Jesuits, we have the same protection that any other person will have. I mentioned earlier that I have volunteered to visit a hospital. I haven't gone yet. I haven't gone yet physically to the hospital, but I am willing to go. I don't mind much me being infected, as I can be a means of infecting others. That worries me more. Mm-hmm. So if I go physically to the hospital, I will try and get all the facilities and take all the measures not to get infected, especially because I can infect others in my community and in other places. And I have served a couple of when people die at funerals. I've served a couple of funerals, and I've tried to take all the means not to be infected. There was very poor people, but I was willing, and I asked permission, and we can do that. I asked permission. I was granted the permission to celebrate these two funerals of people that died, not of coronavirus, but well, it was an opportunity, risky, in which I could get infected. The government's trying to provide the means to avoid infection, and we have to be very responsible with all the instructions they give us. And I suspect that the day I will have to go to the hospital, I will have the means so that the risks of infection are low.
Right. And the question was not intended to encourage that you would have to expose yourself to the infection, but more of a clarification of the government's role now that they have acquired the space due to your generosity. Do they manage it? And are they the ones who are providing the funding, or who is actually the provider of all of that?
Well, yes, the government. The government's providing. Well, we offered our retreat houses, 3 of them. They told us they were interested in 3 of our houses, and they have the funds to make them function. We told them we don't have those funds. We have we can offer the house at no cost, at zero. We don't want to profit, no cost. But they said, well, we can fund the people we have to hire, and the material. We'll pay the electricity, the water, the bills, different bills, and we'll make it function. So the government is taking care of all the economic impact of this lending of our houses that we're doing.
Congratulations. You truly are, it's truly a collaborative effort. Thank you.
So I was going to ask, what impressed me really is this sense that you were talking about the need to contribute something, you know, so it's this sense of wanting to be involved, wanting to be generous in the midst of a time when it seems like we're even more isolated and people may feel a little more powerless. There's this sense that we have to do something, and especially do something with the poor. So grateful for that continued inspiration in line with our charism. What I wanted to ask is, has the state actually gone in, and are there patients in there right now in the retreat houses? And then what is there still a liaison with the Jesuits in terms of what's happening there? And are there Jesuits who are somehow directly involved in that process? Maybe as if there's some medical Jesuits with some medical background, or that's what I wanted to know.
Well, we do have some Jesuits with medical background, and they are helping in other cities. Like in Puerto Montt, for example, one of the members of the community, the Jesuit community in Puerto Montt, he is a medical doctor, and he's involved with all the team at the hospital where he's working. And he's very much involved in that. And as that example, we have others, not many, but we have others. And yesterday we started getting people into the retreat house, elder people that are going to do the treatment at our retreat house. So it has started already. It's already started.
Excellent. Other questions? And I'll add to those who will be watching this on Facebook that you could add questions into the comments, and we will try to follow up with answers as best we can.
This is Annie. Augustine, it's really just amazing to hear about the work you guys have done. You know, I know that here we've had some retreat houses that are in conversations with their local government. And we've had some schools that have opened up, but people are worrying about endowments that are going down, things like that. But they've been asking for funds from the government in order to do this, for funding for this. And how did you guys move through that?
We've had a great impact in our endowments. We've lost 20% in this crisis of our endowments. So, but we're not worried now of an economic. We know we're going to have a very hard economic impact on our capital as a province. But now it's a time to be generous. It's a time to extend our contribution to the people that are poor, that are in need, that are sick. And if we don't contribute now, we realize that this is going to be a much, much bigger and greater crisis. So if we contribute now, if we're generous now, perhaps the impact of this crisis might be smaller. And we feel, and that it hasn't been an issue. We never asked the health authorities. We wanted to get an income to make a profit from this. No, we hand over. These are our resources. We hand them over to you. You can administrate them, and our idea is that they will help the people that are in need, that are sick. But the economic issue hasn't been a problem for us till now.
That's great. Because those are real questions, real challenges, right, that people are facing. And I think, as you said, in times of difficulty, we're all challenged. We all want to do the good and be generous, and yet we also are often watching the difficulties that are around us, and it can be a lot of challenges and fear. Certainly, I think Pope Francis has spoken to that. Father General has spoken to that. I really appreciate how you're giving us a concrete example of what that looks like, at least in one Jesuit province. Just see one more time if there was any other questions. Yes, Federico.
Agustin, I don't know where to start. I'm very moved. I'm a professional palliative medicine chaplain for 15 years in two major universities here, Stanford and USC. So working with very sick and dying people for 15 years, I cannot imagine how much good you are doing already. And I'm very moved by that from the beginning. But you mentioned something, and For somebody who grew up in Brazil and Uruguay, I know a little bit of the relationship between the government and the church, and especially after the social scandals, with the community, and in Chile. Do you think this experience of collaborative work is bringing some healing to that wound?
Yes, of course, of course. Well, our province has been deeply impacted last year through our sexual abuse scandals. Well, and this year with this virus pandemia, coronavirus pandemia. And we feel that as a province, and it was very important, our retreat last February, in which we could go through what we have lived in the past year, which has been very, very strong, very deep, very hard. But we realized you can focus on the gospel and on Jesus, we will be able to gain confidence and recover part of that confidence that we've lost through the sexual scandals. And we feel that's what the gospel tells us. We have to follow Jesus. And today we have to wash the feet of the poor. We have to wash the feet of others. We have to be close to the sick people, to the people that are dying. And it's not an economic problem. It's a human problem. It's a spiritual problem. And that's the main problem now. And if we do that, well, we're doing what we're told to do. We're doing what our vocation says. We're doing what our vows tell us. So I feel this disease and this pandemic has helped us to focus on the essential, on the most important thing. And that's to try and follow Jesus and try to listen to him and to see what he has to tell us in this moment, in this time.
Thank you very much. Thank you.
Well, thank you. Thank you again for this, for your words, your example, your description of what your province is going through, and what for all of you is something that hopefully will be a place and opportunity for the kind of healing, a healing that I think we all know our society in general needs, and that we can need as individuals as well. It's such a powerful message for this Holy Thursday to hear, and I encourage all those who are watching to please to share this message out, whether on Facebook or through other means. To feel free to contact us again if you have questions, to put them in the comments, and to stay in contact to spread this news, and to then to reflect on how we in our own places and locations might be able to do the same. Father Agustin, thank you so much for being with us. So grateful to your example. Wish you all the best. If we can be assistance in any way, please let us know. Whether certainly we will share out this story, but if there's other more specific steps that might be helpful, please feel free to reach out to us. Know that you will be in our thoughts, in our prayers, for this good work and for all the work that you will do over this time. Thank you.
Well, thank you. Thank you very much. Thank to all of you. And we all learn from each other. We've learned a lot from the many provinces in the US related to the sexual scandals. We've learned a lot from you. So we learn from each other. And thank you very much. And well, very grateful for this time we've shared.
Thank you. And thank you all for being here, for tuning in, and for all that we're able to come in on the Zoom call. Thanks for your questions. Thanks for your support. Let's continue to stay in conversation as we go ahead. I will put this together as a little video. Will get posted to Facebook, and I'll share it out as well, probably on YouTube, and I can send you the link when we have it as well. All right. any final comments from anybody before we wrap up?
You know, I just wanted to say, Father Augustine, that I'm so touched and moved by your work. And this is the most special Holy Thursday that I've ever had. And, you know, I also think, you know, we get so caught up sometimes in the process of doing things that things never take place. And I just commend you for being brave, for making this actually happen. And it's just really admirable. And, you know, I think you're following so much what your mission and charism is. And Pope Francis would be so proud of all of you. So thank you for allowing me to participate in this.
Thank you, and it.
I'm grateful. It's as Annette was saying, a perfect way to connect on this Holy Thursday. Thank you all. All right.